Welcome back to the Nice Guys Show, everyone. I am author Phil Torcivia, and my latest books are out. In fact, this one, my latest one, is free today on Amazon. If you go on Amazon, not the paperback version, the electronic version is free. Normally $2.99, so.
Nice.
So I make 100% of zero on that, but still appreciate it if you pick it up. I'm here with Kathy, Doc Michelle, and Dr. Sherry Smith is a chiropractor who's going to, first of all, what is chiropractic wellness? What does that entail?
Well, chiropractic, the practice of chiropractic is all about trying to figure out if your spine has any misalignments in it that will be causing abnormal behavior in your nervous system. So it becomes a surprise to people to know that their nervous system is actually the thing that is coordinating every single function in your body. And if your spine has places where it's misaligned, or what we call subluxated, it can cause abnormal behavior in the nervous system so that your brain doesn't fix your body when it should. Your brain doesn't allow your cells to function the way that they should. So when we chiropractors look at people, we try to look at your spine and find out where those little areas of subluxations are. We do an adjustment to the spine. That's a very gentle approach to stimulating the nervous system, and that allows the brain to plug back into the body and allow the cells of the body to start to work properly.
Okay, so it's almost like you've got your main river as your back, and you've got blockages or twists.
It's exactly like trying to get on the I-5 at rush hour. That's really tough, right? You got to find a different on-ramp or something like that. That's a subluxation.
Okay.
And chiropractors remove that traffic jam, and the information flows through, and then your body can actually work to fix itself.
So it's not just back pain that people, I mean, you could have something.
No, absolutely. You know, the interesting thing is that chiropractic really exists as a profession because people that couldn't get well from all kinds of diseases sought out other alternative therapies. And one of the big things was chiropractic adjustment. And people healed from all kinds of ailments and injuries and illnesses with the use of chiropractic when they didn't find relief from other professions. So the history of chiropractic is really more than a 100-year history of people getting well from scary things. It's turned into back pain lately because of a lot of reasons, but insurance companies and physical therapy and those types of ideas and painkillers and those types of things have really kind of driven the market toward more of symptom relief. But the roots of chiropractic are in health and wellness, and that's what we try to do in our office, which is great.
That is great.
So I have a question for you. I've experienced two types of different chiropractors. One where you go in and, they assess, how the spine's aligned, and they're like, okay, C5's out, let's adjust that, T12's out, let's get that.
Right.
But then I've also worked with somebody where they've kind of done more of the AK or the applied kinesiology approach. So what's your, maybe explain to Phil what that is for starters.
Okay, so when she's saying C5 and T12 and things like that, those are just areas of your spine. The areas of your spine, cervical spine is C cervical spine, T for thoracic spine, L for lumbars, that's low back pain, right? So, some chiropractors just go through each segment, and whichever segment feels like it's subluxated, they'll do an adjustment to that segment.
Now, when you say feel, do you mean that they actually feel it? Or
It's called palpation, yeah.
So you don't actually take an x-ray or anything?
You can take an x-ray, you can't really see subluxation so well with x-ray.
Okay.
AK, which you're talking about, applied kinesiology, is muscle testing to assess where the nervous system sees stress. Right? So if I do a muscle test on you and you've got a problem in that area, your brain will immediately register that there's a problem. Let's just show what that looks like. Okay. So a nice strong muscle test. Hold strong. She's nice and strong. Look straight forward for me. But if her upper cervical spine is misaligned, if we move her head around into different positions, this arm will go weak. So tuck your chin for me, hold strong. Go ahead, and that's nice and strong. Tilt your head back for me and hold strong, and she just blows right out. So every time she looks up, essentially, her brain freaks out. So with chiropractic, we try to find out why. It's going to be something in this atlas area of her spine. Go ahead and tilt your head back for me. And hold strong, still weak, hold strong. I'm just applying a little bit of pressure to that segment of her spine. Right there, she's really strong. I can push as hard as I want, and she's really strong, but if I let go, she just blows right out again. So that's really important because her brain is not getting the information that it needs, and her brain is not able to tell the body everything that it needs to do about her immune system, her digestive system. How is she going to really detoxify her body effectively while she's doing this cleanse if the part of her nervous system that controls detoxification pathways is not firing? And so with an adjustment, we just do several different kinds of adjustments you can do depending on what style of chiropractic you perform. But we try to remove that interference by realigning that area of the spine, and then her brain reconnects to her body.
That's fascinating.
Easy peasy.
And I will tell you, I mean, like, after an adjustment like that, it's true. It's like your brain awakens and all of a sudden you're like, oh, geez. It's like, I don't wear glasses, but when you hear people say, never knew I needed glasses, and all of a sudden I got glasses and I could see the world.
That's exactly how it feels.
Exactly how it feels.
I feel like you think it feels like the power being turned on, you know?
That's what we call it in chiropractic.
I've been going to Sherry for
sure.
6 or plus years. I go once a week, and if I miss a week, I definitely notice. It just, to me, it keeps my power on and the brain communicating to the rest of my body, and I can go in there with anything, and she can muscle test it, diagnose it, figure out what it is, and it always works.
Wow. All right, well, that's great to know, for sure. I'll bet you most people probably, I'm sure I have the same problem you do. I guarantee it.
The thing is, almost everybody has a symptom like that or a problem like that. Yeah. It's just in varying degrees, right? Yeah. So she's a healthy person. She gets worked on a lot. And so hers is probably not causing the kind of neurological problems that some people have. But some people have that, and they're getting migraines or headaches, or they have learning disabilities. Children that have that have problems focusing. Like all kinds of things can go wrong with that. People that get sick all the time, or their digestive system doesn't work, or whatever.
Well, you'd never think that was related to your spine. You just think,
right, and you never think like,
the right food.
Yeah, you never think like, oh, I have a stomach ache, I should go to see my chiropractor. But our patients do think like that, you know, because they know that when something's wrong, it's because there's a glitch in the way your nervous system is making that information superhighway run.
Yeah, the connection's broken.
And there's a super cool chart, which I absolutely love, but it shows the spine and how different segments relate to different organ systems.
Right, that's the autonomic nervous system chart, correct?
Love it.
Yeah, it's fantastic. And that takes the whole back pain, headache, shoulder pain kind of out of that and builds into, you know, we do a lot more than just treat pain. So it's fantastic.
Okay. Well, what do you get done when you go there? Just
I mean, adjustment, it's just, and she also has some other healers in there too, acupuncturist, cranial sacral therapy, but I get adjusted once a week, and it's my happy time, my happy place.
Now, is there like stretching involved in it, or I mean, what is a normal adjustment? I just think of like,
it's hard to.
I think of things cracking.
You go on this Hannibal Lecter table, and we
have a motorized table that goes up and down, but people do it different ways. But the adjustments are all usually very gentle. There are some people that have more forceful techniques, but even those more forceful techniques are still quite gentle when you're having them done to you. It looks and sounds scary, and chiropractic has sort of gotten a bad rap over the years, but really the adjustment is all about releasing or relaxing the stress and tension in your system and getting your body to work better, so it feels good.
Right, no one's in pain when they leave
the office,
so they feel better.
Well, if they were in pain when they came in, sometimes they're still in pain when they leave, but for sure, and they don't necessarily always feel better. I mean, you can do something that helps your body function better that doesn't necessarily feel better, kind of like doing a cleanse. That doesn't feel great until you're done.
Right.
You know, so so it's not necessarily symptom management, but it is about getting the body to function at a better level. So, which is important, especially weekends like this past weekend. I played baseball with a bunch of 45 plus guys. In Las Vegas. You're 45? I'm 50. I'm going to be 51 soon. Wow, 50 with a crutch. That's right, getting there. But it's funny as we get older. Of course, our minds tell us that we can still do the things we did when we were 20. Well, here's the thing. You still can do the things you did when you were 20. You just have to do different things to prepare your body. Right. That whole thing about you're getting older and you need to stop what you're doing and you need to downplay what, you don't have to live like that. You can do everything that you want to do that you did when you were a kid. Mm-hmm. You just can't ignore your body and do it. You have to train your body to still perform at that level and make sure that you're using your body properly. Like Nolan Ryan, he pitched forever because he had pure joint mechanics. Right. So that's what chiropractic is. It's about getting pure joint mechanics so that your nervous system can help your body work better. Sure. And Jamie Moyer, same thing. I think he's almost 50 now, and he's still in the major leagues. He's amazing. Wow. Yeah, so Michelle came actually with us out to Vegas, so you got to see some of the firsthand injuries that are typical. Yep. We saw mostly hamstring problems. Is that mostly stretching? Well, this is the thing too. Is it's like that you guys aren't stretching. You're drinking, and then you're playing in hot weather. Yeah. Do you know what I mean? So a lot of dehydration. Yeah, vodka water. Right. Yeah. So, but no, typically I would say low back strains, hamstring strains. Yeah. We had a couple pulled calves when we went out for the World Series tournament. Yeah. Those are almost always related to pelvic instability and tension in your spinal cord. If you don't have pelvic instability, you don't get hamstring cramps. If you don't have tension in your spinal cord, you don't get calf tension. Right, because you're overcompensating. So something's out of alignment, you're overcompensating, and that's what's actually pulling muscle. That's exactly it.
Because your body's saying knock it off, and
your body's saying stop, and we're
injury,
hitting the mute button and saying like, I can still do it.
Yeah. And now you can't play.
Oh.
Huh. All right. So the way to avoid those things would be to drink more water, stretch before the games,
get adjusted,
so you are in alignment.
That's right. That's
exactly. And so what do you do afterwards? Like I had to throw a bunch of innings this weekend. And obviously, I'm more tired than sore. I've been fortunate throughout my baseball career.
So you pitched?
That I never really have any
So
major
let's just
problems.
see what's going on with your shoulder, because it's a little tight and sore, right? So hold nice and strong.
Mm-hmm.
Okay, that's good. Hold nice and strong here. I'm going to pull, straighten your elbow for me. I'm going to pull down and away. Lower this down to here and hold nice and strong here. And see how you can't really do that one so well? I'm barely pushing. You can't really do that.
Right.
If you hold here, you're okay. So your shoulder's out of the socket a little bit. It's not dislocated, but it's what we call subluxated.
Okay.
If we just kind of realign that shoulder a little bit, that's not an adjustment. That's just stimulating the nervous system to see if we can get it to work a little bit better. It's great. If I pull that shoulder out again, it goes weak again.
Yeah.
Okay?
Yeah.
So that's what a chiropractor would do. They would adjust that shoulder to matches that joint a little bit better, and then stimulate the nerves in the neck that make those rotator cuff muscles fire, and then all of a sudden your shoulders reattach to your body and you feel dynamic instead of sore or tired or old or whatever, however you feel.
So this is the thing you would do before or after? Or both?
Absolutely both. I work a lot with senior women's golf tour, and they get adjusted before and after they play so that they're healing while they're sleeping, and then they perform well while they're performing.
I'm going to take you up on that because we're going back in May, Memorial Day weekend, so I'm definitely going to take you up. We'll come back and continue our discussion about chiropractic when we get right back.
Good job.